everyone. Welcome to the first of two public hearings for the Maine State Plan on Aging. Before we get into that, we're going to do some introductions, go over the agenda and things like that. I would like to introduce myself first. My name is James Moorhead. My pronouns are he, him. And I'm the Healthy Aging Services Manager here at the Office of Aging and Disability Services, where my team and I oversee everything Older Americans Act funded, with the exception of adult protective services. We're going to explain a little bit more what that all entails. There's a slide a little bit later explaining what the aging network looks like in Maine. So I'll save you those details till a little bit later. So Elizabeth, do you want to introduce yourself?
Sure. Good morning, everybody. Thank you for being here. My name is Elizabeth Gattine, and I coordinate the Governor's Cabinet on Aging. And in just a moment, I'll just spend a minute or two talking a little bit about the cabinet and how it relates to what James is talking about here today. But thank you for being here.
Thank you so much. And Karen, do you want to briefly introduce yourself?
Sure. Good morning, everyone. Great to see you all. Karen Mason, Associate Director at the Office of Aging and Disability Services, and I oversee the Healthy Aging Services and Long-Term Supports and Services in Maine. Welcome.
Thank you, Karen and Elizabeth. So today is, like I said, one of the first of the two. I'm sorry. Is everyone able to hear me? I see some thumbs up and some head nods. So yes. Okay, good.
Yes, we can hear you.
Great. So yes, this is the first of two public hearings. So today is from 10 to 11:30, and this is going to be repeated on May 2nd, this Thursday, also from 10 to 11:30. So you obviously found the registration link for today, but for those who may be not familiar or not able to attend, the link is still active for Thursday's public hearing. So you can also register for that. It's just going to be a repeat of today. So going over the agenda today, we're going to provide an introduction. From the Governor's Cabinet on Aging, from our friend Elizabeth. After that, I'm going to provide an overview of the Older Americans Act programs services in Maine, followed by a summary of the State Plan on Aging, and then we're going to open it up for public comments. Just a couple of housekeeping notes. Please keep yourself on mute so that we can minimize background noise. We will be monitoring and muting participants during the first part of the presentation so that we can minimize that background noise. So if you do, during the public comment period, if you do want to verbally provide your public comments, you will have to come off mute. Finish that. Next slide. So how can you submit public comments? We are accepting written public comments until May 17th of 2024. You can submit those written public comments in an email, a Word doc, however you would like. You can submit that directly to me. My email address is james.moorhead@maine.gov, and Moorhead is spelled Moorhead. You can also provide public comments through the chat feature of this Teams meeting, and also, like I said, during the public comments portion of the agenda. It is important to remember that responses to comments or questions will not be provided during these public hearings. Instead, formal responses will be provided in the final version of the State Plan on Aging, which will be published on our ODES website.
Have you been on any other meetings today?
So with that, I'm going to turn it over to Elizabeth for her portion of the agenda.
Thank you, James. And again, we are here to talk about the State Plan on Aging, but I do want to just mention the Cabinet on Aging and how the work that we're here to talk about today ties into some of the other work that's going on in the state. And as I mentioned earlier, I coordinate the Governor's Cabinet on Aging. And I sit within the Governor's Office of Policy, Innovation, and the Future. And that is an office that was established to really look at policy and planning for some of the key priorities of this administration. So housing, as we all know, climate change, response to the opioid epidemic, food insecurity, the Children's Cabinet, and of course, the Cabinet on older adults as well, the Cabinet on Aging. And I want to just thank James for all the work he's done here, and Karen and the Office of Aging and Disability. There's an advisory group that James is going to talk about. And I just cannot stress how important it is to hear your voices and your experiences as part of this process. So for everybody who is participating, whether prior to this in the development or now, thank you. So very briefly, for many of you may know, but just to be sure that you're all aware that the governor did establish a cabinet on aging to elevate the voices of older adults and to advance policy and programming that assures we can all age safely, affordably, and in ways and setting that best meets our needs and preferences. And it is made up of the leadership, essentially the commissioners of 8 different state agencies. So it is really trying to break down those silos and coordinate across state government on our shared goals. And the ongoing work of the cabinet is rooted in the principles of inclusion and equity, and that Maine benefits from the involvement, experience, knowledge of older adults in every aspect of our community and the economy. So that's really the underlying principle upon which all of our work is built. And very briefly, again, James, if you want to go to the next slide. Here are some of the bigger focus areas that we have as part of the cabinet. You will see they are very broad. They are intentionally so, but the goals and that we have many of our strategies aligned around are really to create sustainable living in community. And that includes creating resilient communities for now and for the future that are safe, where people have the services that they need to age comfortably. So everything from housing, transportation, food security, other services and support, and really looking at the resiliency of these communities as we move forward. We cannot do that. We will make no progress if we do not have community connections, which is what is so important to improve quality of life, inclusion, and engagement. And so a large portion of the work of the cabinet is really looking at that piece of community connections and how can we work closely with all partners who have the shared goals that we all have. And of course, engaging older adults in active retirement and work, that also is critical. So these are some of the areas that we work in. And as you will hear next from James, programming under the Older Americans Act and the State Plan on Aging are really important components of this broader work. And you're going to see a lot of similar themes in what James is going to talk about that's included in the State Plan on Aging. And really, that is a foundational element to the cabinet, along with other work that is happening around the state. So one thing I will do is in the chat, I will put the link to the cabinet's website. We recently just published our first report around some of the activities, and you will see more connections to this work. But I just want to thank you all for being here, for listening, for lending your voice. And I'm now going to turn it back to James so he can talk a little bit about all the work that's been done and then open it up to hear from you, which is the most important part. So thank you all, and thank you, James.
Thank you, Elizabeth. As Elizabeth said, the Older Americans Act is an important piece of the puzzle in serving older adults and their family caregivers and across the nation. The Older Americans Act, which was enacted in 1965 and has subsequently been amended several times since then, with the most recent being in 2020. And there's already plans to reauthorize it for another time. So they're already talking about what changes they want to make to the Older Americans Act in the next year or so at the federal level. So, under the Older Americans Act, it establishes the U.S. Administration for Community Living as the federal administrator of the grants across the nation, and they award grants to state units on aging. There are 56 state units on aging across the country. That includes the inhabited territories like DC, Guam, Puerto Rico, U.S. Virgin Islands, and so forth. Um, so in every state, there is a designated state unit on aging, and that is oftentimes within departments of health and human services, just like Maine. So the Office of Aging and Disability Services is designated as such as the official state unit on aging to administer the state plan on aging, as well as manage the grants that are awarded each year. The Older Americans Act grants are formula based, which is largely population. Maine is a near flat funded state, so there is a minimum funding threshold for all state units on aging. Maine is really close because of our population size comparative to the rest of the country. In order to be able to receive those grants, each state unit on aging must submit what is called a state plan on aging. It is for a 4-year cycle, up to a 4-year cycle. Some states, I don't know why they would do it, but they do 2 years. That would be, some do 3, but Maine definitely does 4 years. So that period starts October 1st of 2024 and goes through September 30th of 2028. This is viewed as a grant application that demonstrates how the state of Maine is going to be using these grant funds in the upcoming 4 years. And that is described through goals, objectives, strategies, and outcomes, which we're going to cover a little bit later in today's presentation. The state plan on aging is focused specifically on the programs and services funded by the Older Americans Act. So as Elizabeth mentioned, and as mentioned earlier, the Older Americans Act funding is a part of the larger picture, and that larger picture oftentimes includes our Medicaid and state-funded programs. But I want to be very clear that the state plan on aging is about the use of OA funds. So what does the Older Americans Act look like? This has morphed over time, but the current state, and I won't go into the history lesson of the Older Americans Act now, but then in its current state, there are 7 titles we call titles. Title 3 is the lion's share of the funding and the focus of the Older Americans Act. And these are the funds that are awarded to our aging network partners, our area agencies on aging, Maine Long-Term Care Ombudsman Program, and Legal Services for Maine Elders. And there are subparts within Title III that go through B, C, D, and E. So Maine receives a grant specific to each subpart. So there are 4 grants under Title III. Title IV is discretionary grants. These are often those competitive grants that states and AAAs apply for. And this also funds the research centers at this federal level to help coordinate on a larger scale. Title V is the Senior Community Service Employment Program. Maine is a grantee of Title V, and we directly administer the CSEP program in Cumberland, Lincoln, and York counties. Our national grantee, Associates for Training and Develop, covers the other 13 counties. There are direct grants for Native American programs, and I'm going to cover that a little bit later. And we don't receive those grants directly. That goes directly to the Title VI grantees. There's also Title VII, which is the Vulnerable Elder Rights Prevention Activities, and that is funds that we receive for our Ombudsman program as well as APS, our Adult Protective Services program. So what does that look like in Maine? So I know this is a very busy flow chart, but I think it's a very important one. So at the very top, we have the Administration for Community Living, which we call ACL. That's our federal grantor. They've overseen the Older Americans Act across the nation. They award funds directly to Title VI grantees, which includes our 5 tribes in Maine. And that includes the Passamaquoddy both Passamaquoddy, Pleasant Point, Passamaquoddy, Indian Township, Penobscot Nation, and Becback Nation. There are 3 Title VI grantees because there's a consortium of, and the Holton Band of Maliseets, I'm sorry, that was the 5th one. So Holton Band of Maliseets and both Passamaquoddy tribes formed a coalition, and that is one Title VI grantee. This is important, but as we're going to touch a little bit later, the Older Americans Act requires that states and AAAs coordinate with Title VI grantees to serve tribal elders. So part of the state plan on aging that's proposed outlines how we as a state agency, as well as the area agencies on aging, are going to coordinate those efforts between Title III and Title VI. As I mentioned, we are a Title V CSEP grantee, so we also receive funds from the Department of Labor, who oversees the Title V grantees. And so we receive those funds directly from ACL and DOL. From there, we award Title III funds through a series of contracts with all the partners that are listed. We have a direct service contract with Legal Services for Maine Elders, as well as the Maine Long-Term Care Ombudsman program. And we have unique contracts with each of the 5 area agencies on aging that are listed here on the screen. That includes Aroostook Agency on Aging, Eastern Area Agency on Aging, Spectrum Generations, Seniors Plus, and Southern Maine Agency on Aging. In turn, the intent of the Older Americans Act is that the 5 area agencies on aging, their mission is to develop and administer a coordinated, comprehensive system of care for older adults and family caregivers. And they do that also by awarding both federal and state funds to local service providers, those providers that are providing care in those local communities. And off to the right, we also, the Maine Council on Aging, while we do not directly provide funds for the Maine Council on Aging, they are an important partner in the Maine's aging network and serve as our advocacy voice, both for the area, mostly for the area agencies on aging. And we do a lot of collaboration with MCOA on a lot of the initiatives that they work on. So this gives a pretty good picture of what the aging network looks like in Maine, and it identifies who those key players are. On this slide is illustrating the coverage area of each area agency on aging. And it also provides the contact information for each of the area agencies on aging, who are also aging and disability resource centers. These, what we call ADRCs, or Aging and Disability Resource Centers, are meant to be that first point of entry for older adults and their family caregivers who are interested or needs help. They are the ones that can provide that information and assistance and case management services, coordination, do that initial eligibility screening, benefits checkups, those type of things to help individuals know where to go. They are valuable resource centers, and each area agency on aging operates one. Both Maine Long-Term Care Ombudsman Program and Legal Services for the Elderly are headquartered in Augusta. However, they provide statewide services. And it's also important to note that each of the area agencies on aging subcontracts with legal services for the elderly to provide legal assistance statewide. So how did we get here? I want to provide a little bit of an overview of the development of the Maine State Plan on Aging. This started almost a year ago in July of 2023, where we convened an advisory committee consisting of internal and external stakeholders, including some diverse community-based organizations, to help review and approve protocols and what information did we want to collect as part of the statewide needs assessment. So part of the Older Americans Act requires that states assess the needs of older adults in their state and use that information as the basis of their goals, strategies, outcomes, and objectives of the state plan. So I'm a huge proponent of an inclusive planning process. So I wanted to make sure we had diverse voices from the get-go as part of our advisory committee to help ensure that we are targeting our services to those of greatest social need and economic need, which I'm going to define what those mean a little in a slide later on. After the advisory committee had an opportunity to review and approve the statewide needs assessment, we contracted with the University of Southern Maine, the Catherine Cutler Institute, to conduct what we call the 2024 Maine Aging Study. So this Maine Aging Study consisted of focus groups, key informant interviews. We did a statewide mailed survey as well as a telephone and caregiver focus groups and a survey. I'm trying to think of the other. We did both qualitative and quantitative data collection, and we targeted our qualitative data collection to really elevate those voices of underserved populations across the state. So that included focus groups with older individuals with IDD. I think that was turned into a key informant interview, but LGBTQ older adults, both rural and urban, our new Mainer population, as well as which Asian older individuals as well. So we really wanted to target those qualitative, like I said, qualitative data collection to really elevate those voices because they can be often hidden in the quantitative data. So they concluded that in October of 2023. From then until December, USM was very busy analyzing a lot of data that they collected, and we're going to review some of those findings a little bit later. They provided a report of preliminary findings and a draft reports for both ODES and the area agencies on aging to look at, okay, what are the findings? Where are those areas of needs that the state plan on aging should address? After that presentation, we convened a series of advisory committee meetings in January to February of 2024. And that's where we were really discussing the goals, objectives, strategies, and outcomes that you're going to see as a little bit later on, and it's definitely outlined in the state plan on aging. In March of 2023, we provided a draft to ACL for their preliminary review to make sure that what we were proposing in our state plan on aging met their expectations and requirements. We received about 10 comments back from them, which were pretty minor. I think that was a pretty good success. We addressed those comments and published a draft of the state plan on aging on the ODES website on April 12th. The Older Americans Act and the final rule that was published this spring includes that there has to be a 30-day public comment period. So the public comment period started on April 12th and goes through May 17th. We are currently here on April 30th, and on Thursday, we're going to have the public hearings. After we collect those public comments, written and the comments that we're going to collect from you a little bit later in this meeting, we will provide those formal responses, and then we go through the approval process with the ODES director signing off, the DHHS commissioner, and ultimately the governor has to sign off on the state plan on aging. And we have to submit an approved and signed state plan on aging to ACL by July 1st. So as you can see, it takes a full year's worth of planning and coordination to develop the state plan on aging. And we could have not done this without our committee members and also input from the public through the needs assessment process. There was a question in the chat about copies of the findings. Yes, a summary and a full listing of the findings is available on our website. If you go to our ODES website under data and reports, a copy can be found there. There is a link on on these slides that will be shared as well. A draft of the 2025 to 2028 Maine State Plan on Aging can be also found on the ODES website under policies section. Under About Us, under policies, there's a column for proposed drafts, and that is where you can find a copy of the draft state plan on aging.
And James, I just put the link to the needs assessment in the chat.
Great. And could you also put the link to the state plan on aging as well?
Will do.
Thank you. See, teamwork. So now I would like to provide a summary of the state plan on aging. It's really important to understand when we did this with the advisory committee as well, it was important to understand what was ACL's expectations and what are they looking for in state plans on aging. There are 2 guidance letters that ACL issued, and they can be found on the ACL website. The first letter is a broad overview, a pretty comprehensive guidance letter about what is expected. There is also an equity complement letter that ACL issued to clarify greatest social need. So those were our guideposts and basically what are our guardrails in terms of developing the state plan on aging. In the first letter, there are required focused and topic areas that must be addressed by state plans on aging. That includes OAA core programs. Those are the Title III programs that I shared on the previous slide, the supportive services, nutrition, evidence-based programs, and caregiver services. There is also a requirement or a topic area around COVID-19 impact. We are still dealing with the impacts of COVID-19 from a systems perspective, and ACL was wanting to know how are states implementing lessons learned through the pandemic, and in terms of innovation, as well as certain needs that rose up, like social isolation was a huge need during the pandemic, and it is a great focus of the Older Americans Act. There's an equity component to this. Another topic is expanding access to home and community-based services. This is where ACL wants to see that coordination with Medicaid and state-funded programs and services with Maine's aging network, because there's a core tenet of the Older Americans Act of supplementation, not supplantation, meaning the Older Americans Act funds are meant to supplement services, not be the sole source of funds for older adults, for services for older adults and family caregivers. And the last topic area that we must be addressed is caregiving. Our partners at USM collected a lot of information and synthesized this into a strengths, weaknesses, opportunities, and threats analysis. So on this slide is the threats and weaknesses, meaning what are those needs and what are those kind of threats to the health and safety of older adults across the state. And so here you'll see some very specific themes that popped up. Like I mentioned, loneliness is a huge one. Um, we could spend 2 hours talking about the needs of older adults and Mainers. And thank you, Elizabeth, for providing a copy of the state plan or the Maine Aging Study findings. If you're more interested in about what those specific details are about that, please go to that report and it spells it all out. This slide highlights the strengths and opportunities that USM found from all the data that they collected. And the ones that are bolded are the opportunities that USM thinks that we could really target and with the use of the funds that are awarded by the Older Americans Act to really improve the lives of older people across the state. And the advisory committee took these findings as the basis for the objectives, strategies, and outcomes that are outlined in the state plan on aging. So with the input and based on the state plan on aging, the Maine aging study, ODES proposes the following as part of the 2024, sorry, that's an error, 2025 to 2028. Apologize for that error. There are 3 goals, 28 objectives, 100 strategies, and 102 outcomes as part of the state plan on aging. It is very thorough. And this is one area where if you look at the current state plan on aging compared to the one that is being proposed, you will notice that there's quite a bit of detail added and expansion. This is a result of the ACL guidance letters. They are wanting states to be more thorough and expansive with their state plans on aging. So if you look at what's currently in the state plan on aging to what's proposed, you'll notice that difference. The 3 goals that are outlined in the state plan, the proposed state plan, are support older Mainers and their care partners to remain active and healthy in their communities of choice. Goal 2 is ensure Maine's aging services and programs are accessible to all older Mainers and their care partners, with emphasis on older adults with the greatest social need and economic need. Goal 3 is prevent and improve response to elder abuse, neglect, and exploitation while preserving the rights and autonomy of older Mainers. Under Goal 1, there are subcategories. These are not the objectives, but they're, as you mentioned, there are 28 objectives, but there are subcategories that we try to categorize objectives into these buckets. As you'll outline, it corresponds with the Title III, B, C, D, and E of the Older Americans Act. There is an assistive technology requirement that we coordinate with the Assistive Technology Act grantee in each state. In Maine, that is Maine site, which is part of the University of Maine, Augusta. There's an advocacy component to this. So we are charged under the Older Americans Act to be that voice of older Mainers and their care partners as policies are being developed, as programs are being designed, as pieces of legislation are being proposed. Integration is focused on how, as I mentioned, integrating with the HCBS, Medicaid, and state-funded services and programs. As I mentioned earlier, coordination between Title III and Title V, which is CSEP, as well as Title III with Title VI, which is the Native American programs. Emergency preparedness. If there's one thing that came out of the pandemic was the need to have an effective emergency preparedness plan, so that when natural disaster events occur, or say God, no, please no, an epidemic or a pandemic happens, how are we going to respond to that as an aging network so that we continue to serve older people? Goal 2, under Goal 2, there is uh, partnerships. The subcategories under Goal 2, focusing especially on greatest social need and greatest economic need, partnerships. The aging network that was highlighted in the previous slide, we can't serve those populations without our partners in the communities. So there's a focus on strengthening those partnerships. One specific focus area is trauma-informed services. So ACL is looking about how states are making sure that aging services and programs incorporate trauma-informed best practices in the delivery of those services. In addition to, ACL also awards ODES grants for brain injury services that's administered by another subunit within the Office of Aging and Disability Services, but they're looking at how are you coordinating with those other ACL grantees, and that's specifically around screening for brain injury. And as well as program monitoring, meaning how is the state unit on aging monitoring the AAAs, and also how are the AAAs monitoring their service providers for compliance with both the programmatic and fiscal requirements of the Older Americans Act. Under Goal 3, the subcategories are the Legal Assistance Program. As I mentioned, Legal Services for Maine Elders is our statewide legal assistance provider. Another category is the Elder Justice Coordination Partnership and the Elder Justice Roadmap. There's been a lot of concerted effort and success around the Elder Justice Roadmap. So we saw this as a great opportunity to coordinate those efforts within the State Plan on Aging. And lastly, the state plan, but not least, is the State Long-Term Care Ombudsman Program. Again, if you're interested about the specific objectives, strategies, and outcomes, please refer to the State Plan on Aging. So I've mentioned a lot about greatest social need and greatest economic need. Per the Older Americans Act final rule, which was published a few months ago by the Administration for Community Living, this is the definition of greatest social need as defined by ACL and is also outlined in the State Plan on Aging. So whenever there's a reference to greatest social need, this is what we mean. As you can see, it's pretty expansive, and it also allows flexibilities around. This is not a mutually exclusive list, meaning this is not the comprehensive list that there's also some flexibility for states and AAAs to target certain populations that may experience that cultural, social, or geographical isolation. The definition of greatest economic need is a little bit more simple. It means the need resulting from an income at or below the federal poverty level, and that is defined by the U.S. poverty guidelines used to determine financial eligibility for certain programs. And this is a common measurement. The other part that is also spelled out in the State Plan on Aging, and ACL has actually beefed this up a little bit in terms of guidance to states, is the intra-state funding formula. As I mentioned, the Older Americans Act is a formula-based grant, meaning it's population-based for how much each state gets. That is the interstate funding formula. Each state unit on aging has developed an intra-state funding formula, meaning how it determines how much each area agency on aging gets of each award that is provided under the Older Americans Act. Here, the requirement is that there must be a mathematical statement of the funding formula, which is provided on the screen. And we also have to provide a breakdown of what the target populations, what the assigned weights, and what the equation notation is. So this provides a breakdown of what the weights are for each specific target population. There have been updates to the what we call the IFF from the current state plan to the proposed state plan, and those updates are highlighted on this slide. We adjusted the weights for age, greatest economic need, and greatest social need to be 30% each, which means there were slight adjustments for each of the categories. So that equal weight was given to age, greatest social need, greatest economic need. Greatest social need included the addition of subpopulation that includes lives alone. So older individuals who are living alone, older individuals living with HIV/AIDS, as well as older individuals 65 plus with Alzheimer's disease. Based on the recommendations from the area agencies on aging, the 3 additional subpopulations were added to the definition of greatest social need, and that is the 3 chronic conditions that, according to the National Council on Aging, are for the state of Maine, and that includes hypertension, hyperlipidemia, and arthritis, which are the top 3 chronic conditions for older adults in Maine. In order to make the equation balance, so 30%, 30%, 30%, which equals 90%, the rural definition was decreased from 15 to 10%. And that is largely because Maine is such a large rural state that, I mean, outside of Portland area and southern Maine, you get into some pretty rural areas. The base allocation was also increased from 15% to 20% to ensure that capacity of the AAAs was maintained. So that's another piece that had to be outlined. The next state, so based on those adjustments, there is a agency shared percentage change, and this is outlined by AAA on this slide. And lastly, on the IFF, I'm sorry if the math is pretty dense. One of the requirements, the new requirements from ACL, is that states have to illustrate the distribution of grant funds by sub-grant award by AAA. So this is copied straight from the proposed state plan on aging, and it illustrates how much each AAA receives of Title III funds based on the 2023 grant awards. The above amounts are just for Title III. It does not include the Nutrition Supplemental Incentive Program funds that we receive. Those funds can only be spent on domestically produced food. And it also does not include the state funding that is also awarded via the interstate funding formula. Yes, intrastate funding. I always have to stop myself. Intrastate funding formula. So the IFF is a really important piece because whenever we are awarded funds or we allocate funds to the AAAs, most funds are allocated via the IFF, and it determines how much each AAA gets. Another piece that I would like to highlight, there is a whole list of information requirements, which is one Appendix B of the state plan. One of the things that I'd like to highlight is, and this has not changed, but I think it's important for individuals to understand, that of the Title III-B awards, we are required to what we call minimum proportion requirements. This is the minimum amount of 3B funds that must be spent on these 3 categories of service. Access services is at 20%, which is largely used to fund our aging and disability resource centers. 10% must be spent on in-home services, which include homemaker, personal care, chore, and some other services like home modifications, other like telephone reassurance is another one. And also 10% must be spent on legal assistance. So each area agency on aging is required to allocate 10% of their 3B funds to legal services for Maine elders. So I know that was a lot to cover. And now we would like to open it up for public comments. I do want to highlight a couple important things. I did get the dates on this one correct. I will go change that for Thursday. So we've concluded the summary and presentation on the state plan on aging that's proposed for federal fiscal years 25 through 28. We will keep the line open in case anybody wants to join and would like to provide comments. As I mentioned earlier, public comments will be accepted until May 17th. And you can submit those written comments directly to me, and my email address is again provided there. You can also provide public comments on the proposed plan through the chat feature, or you can unmute yourself and provide it verbally. It's also like I want to reiterate this again. Responses to comments and questions will not be provided during the public hearing. Instead of formal responses will be provided in the final version. So with that, I'm going to stop talking and I would like to open it up for public comments.
I'd be happy to start. Good morning. My name is Jen Jello, representing Maine's Acquired Brain Injury Council. Thank you for the opportunity to comment on Maine's State Plan on Aging. We are charged with monitoring, advising, and advocating on matters pertaining to brain injury. And the council agrees with the proposed plan to provide screening for brain injury, is outlined on page 36 of the report. The reasons for the council's positive endorsement are fourfold. One, brain injury is a significant ongoing public health issue that affects all communities in Maine. Many individuals will make meaningful recoveries following injury, especially if they get needed rehabilitative care. Among those still alive 5 years following a moderate or a severe TBI, 57% are moderately to severely disabled, and they will live very difficult life-altering challenges. Immediate access to specialized neuro rehab treatment, access to information, access to care coordination is crucial for positive outcomes. Brain injury screening and referral to available services is outlined in the Maine State Plan on Aging is essential to timely intervention. 2, data provided by Maine CDC 2016 to 19, which is the most recent data available, indicates that ER visits, hospitalizations, and the rate of death from traumatic brain injury are high for older Mainers. Traumatic brain injuries caused by falls are the most common among older Mainers age 75 and above. So there's a real need here. Screening and promoting access to care attends to the State Plan on Aging goal for ensuring all Mainers are healthy and safe. 3, an interesting fact, Maine also has a state plan for brain injury, and brain injury screening and enhancing access to brain injury information and resources as outlined in the State Plan on Aging directly aligns with strategic priority 3 of the Acquired Brain Injury in Maine State Action Plan. And 4, the council holds public forums across the state each year to gain feedback about needs and potential service gaps. Year after year, a consistent theme has been that brain injury survivors do not know what's available for services and they feel lost following an injury. The long-term goal outlined in the Maine State Plan on Aging to have more older adults screened and referred to services directly attends to this reported need. As a point of consideration, some additional specificity in the goals on page 36 could be beneficial for ensuring successful outcomes. Could the plan outline how outreach to older Mainers work will occur and by whom? Thank you for your time and your consideration of this testimony. Please do not hesitate to reach out if you have any questions. Thank you.
Thank you so much, Jen. Jen, may I have a follow-up question? Do you have those written and prepared? And could you, if so, could you send that to me?
I'd be happy. Yes, they are written. I'd be happy to send that along.
That would be great. Thank you.
Just as a reminder, if folks feel more comfortable placing their comments in the chat, that is perfectly fine and very welcome. And please don't feel shy to comment. We're amongst friends here. Colleen.
Yes, James, I didn't know if you had received the letter from the Home Care Alliance of Maine with their comments on the plan.
Who would that have come from?
Lori Belden from the Home Care and Hospice
Yeah.
Alliance of Maine.
Yeah, I know Lori. No, I have not.
Okay. We met and had a number of suggestions, so I'll make sure that you do get a copy of that rather than read what I'm looking at right now.
Thank
Appreciate
you
it.
so much, Colleen.
Thank you.
Look forward to it. Thank you, Cynthia, for your question in the chat.
You're welcome.
And it is the place to ask.
Okay, I wasn't sure if we were just supposed to submit.
You can verbally say that we do have a cart captioner and we are recording this, so we will be going through and writing down all the comments. So either's fine. You can
Okay.
verbally, chat, email.
Okay, thank you so much.
Um, while people are collecting their thoughts and preparing, one of the things that I'm really interested in hearing from people is one of the focus of the advisor committee and of ODES is hearing from the people throughout the process. So the advisor committee is one of like the first pages of the state plan. You'll see a whole list of who's on that, who was on the advisory committee and what organizations they represented. That's why we also wanted to do all of the focus groups, and we had listening sessions. Um, we also want to use this opportunity to know, like, did we get it right? Did we miss anything? Is there something that y'all think could be improved on? We've already heard some really excellent feedback so far, but I think that's one of the importance of this public hearing is I want to make sure that public voice is included in the development of the plan throughout. So, somebody
Thank you,
has their
Lisa.
hand raised.
Lisa Joyce, you have your
Yeah,
hand
at
raised.
least.
Thank you. Can you hear me?
Yes.
Oh, great. There are two issues that I am in South Portland, and I'm co-chair of Age Friendly South Portland. Our goal for this year, or our big project for this year, is emergency preparedness. And we are working very closely with Cumberland County Emergency Preparedness and everybody in our community, especially the Housing Authority. And I was wondering, who have you identified to be the state point group or person that we could get in touch with to work with as well? The community seems to be extremely receptive to this right at this moment. We all saw what happened a couple of months ago, and it seems to have really provided the impetus for people to get involved with this. And then my second question is around transportation. And we are having a very hard time providing medical transportation for senior individuals who are living in South Portland, and have been trying to work with GP-COG and not having much luck. So if you could give me some help with that, and I'm sorry if those two issues are not for this meeting. We can certainly talk otherwise. Thank you.
Thank you, Lisa. Definitely feel free to reach out to me and we can definitely follow up about those specific questions. And thank you, Anne Marie, for submitting that question. Question is, does the plan have detailed information on how it supports older adults with intellectual and developmental disabilities? I think one of the core things I may have missed in explaining to people is the Older Americans Act eligibility is relatively low for the most part. With the exception of home delivered meals, it's essentially age 60 plus. Is with another exception is older relative caregivers need to be 55 plus under the National Family Caregiver Support Program. So the Older Americans Act strictly prohibits means testing. So there are no assets or income limits to be eligible to receive Title III services. It's really 60 plus. For home delivered meals, it's also the individual needs to have a homebound status, as well as being unable to prepare or cook their own meals. So the eligibility for these services are pretty low. That's where the Older Americans Act says that if funds are not available to serve all older adults, then we are to target our services to those of greatest social and economic need. Sorry if I didn't miss that point earlier, but I think it's important. Yes. Anne Marie, you have your hand raised. Welcome.
Oh, thank you. I think thank you very much. This is, I am the executive director of GMS in Southern Maine that supports adults with intellectual disabilities and autism. However, my comment is going to be on a personal level, with a husband who was diagnosed with early onset Alzheimer's at the age of 58. Oops, my camera on here, sorry. I found it extremely difficult, and I'm 57, so I am over the age of 55, and I was caring for him at home for several years. I found it extremely difficult to navigate the system, to find supports and assistance, and having two kids in high school, who both, cared for their father at home while he was there. He's now in a nursing home. And not the ideal spot, because I'd love him to be home. But hearing some of the information that you've provided here with Title III, I certainly tried to find home caregivers so I could still work, because I am a full-time worker, full-time employment, to watch him while I was at home. I resorted to cameras in the house and watching him while I was at work, and then was approved to work from home part-time. But knowing, I say this all because I feel that I'm fairly resourceful in knowing the field, and I struggled trying to find support and help from my husband, and finally had to resort to nursing home care because I could, financially I couldn't afford to pay for somebody to support him. He's a two-person lift. He's a Hoyer. He doesn't walk. He doesn't feed himself. And so I would much rather still to this day have him at home, but the system does not support or allow for that to happen in a in a meaningful way where there's, I've called area agency on aging. I mean, I went down through the list, and all I heard was, I'm sorry, there's nothing we can do. So for other older Mainers, especially those who live in rural areas, I'm certain that they're not, majority of them are not able to really understand what resources are available are out there to them, and how to even begin the process of receiving help and services in Maine.
Thank you, Anne Marie, for sharing and providing those valuable comments. Anne Marie, oh, good. I was just about to ask. Any other comments, questions? Great comments so far. Yes, Colleen. No, I can't hear you. There you
How
go.
about now? See, I had to call in, so I hear an echo, so I'm hesitant to talk, but to follow up on the previous commenter, I wonder if we have enough in the state health plan to address the critical long-term care crisis. I think it's a crisis that our state is in with respect to closure of nursing homes that are converting to residential care, and new federal regulations that are going to require 24-hour nursing, RN nursing in our nursing homes, which across the state of Maine, we simply don't have the workforce to support. So I am really concerned about that and if we have done enough to address that within the plan. Thank you.
Thank you, Colleen. So as I mentioned earlier, we will keep this line open until 11:30, the scheduled time. So um, feel free to hang out with us or provide additional comments if people are still thinking about and formulating their comments and responses. We greatly appreciate the comments so far. And like I said, if you have prepared written comments, please, my email is on the screen, so please be sure to send them to me. And we look forward to them. Thank you, Colleen. Oh, it's rain, I hear. But Claudia, if you're here, the first little recording was just when it started, but as soon as this is concluded, a recording will process and then be uploaded. So you should be able to find it in the same place you found this recording. So after this, you should see two recordings. One's only like 14 seconds, and this one so far is an hour and 26 minutes. So I think we're all learning with technology, Claudia, every day. And Claudia, if you uh, would like to submit any follow-up comments or questions regarding once you have had a chance to review the recording, you can always send your comments and or questions about the state plan on aging to my email address that's listed on the screen. And again, we will be accepting those comments until May 17th.
Well, it looks like we're coming up to about 11:25, and we have a small group left. Before we sign off today, since we haven't had anyone joining for the last 30 minutes, unless there's anyone on the call that still has some comments for us, I think we're going to go ahead and sign off for today. We thank you very, very much for your comments. And as James has said, please feel free to send written public comments until through May 17th at james.moorhead@maine.gov. We are happily taking those comments through that date. And we have the same public hearing on Thursday of this week as well. So we appreciate your time and effort today. We know this is a very dense at times, as you've heard earlier, state plan, but and it's taken a year, and you can see why it's taken a year to pull all of this excellent information together. Thank you very much. James, would you like to say anything before we sign
No,
off?
I say thank y'all, whoever's watching the recording, thank y'all for the public comments, and definitely look forward to receiving, as Karen said, the written public comments. So thank y'all so much. Y'all have a good day.